time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hi, pet lovers. It's Dr. Bob, and it sure is great to be back on a regular schedule. So we have several sponsors, and I always start off by thanking them. Elanco, the maker of Trifexis, which is really the next generation of flea control, internal parasite control, and heartworm protection in one monthly chewable pill. No topical applications. It's a great product because we live in Northwest Ohio, and ticks are a problem. If you've ever had a tick problem before, or you're concerned that you will this year, April's been so cold. We just haven't heard much. I haven't been in the office either, of course, but I'm not hearing anything from the office about ticks starting to flare up. Been awfully moist, so I think that's going to contribute to some tick problems. So what we recommend there is that you can certainly use your topical application, Frontline Plus being the product of choice topically. But quite frankly, we think that the combination of Trifexis and a collar that lasts for 6 months called Scalibor is the best way to go. Another one of our terrific sponsors is Hill's Pet Food, and they're the makers of Science Diet and the prescription diet line of foods. There is advanced science behind all of their products, not just at the development time, but in an ongoing way that they're constantly trying to apply science to the formulations and apply science to the proper way to feed, whether it's in prescription diet with heart-friendly diets or kidney-friendly diets, or something that we're going to talk about a little bit later today, diet that's specifically designed to help treat a condition called hyperthyroidism in cats. I think that that's really one of the keys when you start looking at a dog food or a cat food that you're going to buy and feed to your pet. You should be buying foods from companies that are investing in the scientific knowledge of nutritional feeding. You're going to get better nutrition for your pet, and you're going to get it at a better price as well. Esplin Medical, which is the manufacturer of the most unique product on the market in the way of surgical scrubs. They are made of 55% bamboo, 25% cotton, 20% polyester. They are so comfortable it is like wearing pajamas, yet they are environmentally friendly. They wash in cold water. They dry on a very low heat or fluff dry. They are stain resistant. They are naturally antimicrobial. The only problem we have with bamboo scrubs is to get the word out there, because nobody else is making this product anywhere else in the world. This is a truly unique product, and it's kind of fun to be a part of it. But boy, the marketing effort that we have to expend to try to get people to understand that if you Google bamboo scrubs, you're not going to come up much. But you can purchase these online at www.esplinmedical.com. In Toledo, at the Toledo and Westgate family pharmacies, carry 2 of the 4 colors. Hopefully in the near future, there's going to be a much bigger online presence, as one of the big suppliers is looking at this line of product. Sylvania Vet, my office, running smoothly in my absence. You oftentimes wonder how you're going to feel about that. You don't want them to fall apart. You like them to suffer a little. Well, the reality is that they haven't suffered at all, other than the fact that they've had the doctors and the staff have had to work a lot harder with me not being there. And I can't tell you how much I appreciate the effort that all 5 of my doctors that have been working extra duty are doing, and they're maintaining our terrific service. I just put a plaque for this week for our 6th Best of Award in a row, and so we're very proud of that. What makes this the best? Well, what other veterinarian in the area answers the phone 24/7? What other veterinarian in the area has a doctor on call 24/7? What other veterinarian in the area has 24/7 staffing in the building so animals are never alone? When you're considering choosing a veterinarian, those should be things that are important to you. They should also be important that it's inspected by the American Animal Hospital Association. We are the only 24/7 general practice that is inspected by anybody in the veterinary veterinary profession. The state does no inspections of any veterinary practice. That ought to be hypercritical to you as a pet owner. Check us out on our website at www.sylvaniavet.com, or call us and test us and see if we answer our phones at 2 o'clock in the morning at 419-885-4421. I got a list of questions, and I love it when we get some questions. That means I don't have to design all the programming, which is pretty nice. And so Jessica sent me a series of questions that all relate around the weather changing and it's getting nice. And first part of her question was, how often should we bathe our dogs? Well, the simple answer to that is you bathe them as often as they need to, but no more often than necessary. So if it's wet and muddy outside and they need a bath 3 days in a row, then you do that. But, if you can rinse them off and get the dirt and mud off of them without having to use a lot of soap, you're not going to be washing away the body oils, which could ultimately lead to drying of the skin. One of the products that we like a lot for general bathing is called Plum Silky. It's very concentrated, has a nice little plummy odor, and has a built-in conditioner. We like that product a lot and something that we recommend. Can we bathe our cat? Well, the answer is yes, but do it more like a shampoo. Don't try to stand your kitty in the water. And you can do an awful lot with a wet washcloth and a comb and brushing through. They, of course, groom themselves. A lot of times as cats get older, get arthritic, they don't bend and as much, and so they don't groom themselves. Those kitties need to be groomed. Use a flea comb type comb and comb in layers to remove hair that's coming out so that it doesn't mat. Another part of the question, is it better to have bathing done by a professional? Well, I think that one of the things, if you have a longer haired dog, it's going to be very difficult for you to do a thorough job of brushing before and after getting the mats out. Is if you bathe a matted animal, it's going to make the mats worse. Likewise, getting it thoroughly rinsed and thoroughly dry can be a challenge without the appropriate equipment that a professional has. Is it better? Well, my grooming staff would say yes, it's better. But I think that if you have a lab, you can certainly do it yourself. And by midsummer, the water coming out of the faucet outside is warm enough that you can do it without having to mess up the tub. And that's another whole issue. Sometimes having the professionals do it and letting us manage the mess is a much better way to go. So you can call our office at 419-885-4421 and talk with our groomers about whether your dog would be better off groomed, brushed at home and bathed at home, or bathed at the office. How often should we have our pets trimmed, ears, nails, etc.? My groomers suggest about every 6 to 8 weeks, 10 at the most is a pretty good timeline in that area. A lot depends on what you like your dogs to look like. My wife has our Portuguese water dogs groomed about every 8 weeks, and by the 8th week, they really need it. That hair is really thickened up. And should we have our pets on a winter-summer feeding program so they don't gain weight? Absolutely. You want to adjust the diet so that they're not eating excessive calories. In the summers, they're going to be out more, probably getting a little more exercise. You're going to be walking them more. It's like right now, it's not much fun to go out and walk your dog because you're just freezing. You're freezing yourself. And so in the summer, you're going to take longer walks and you're going to go to the park more often. And so they may need a few more calories. Or on the other hand, you may feed, if you didn't cut them down in the winter and they put on a little winter weight, then they can trim that down for throughout the summer. Well, it's time to take a break, and we'll be back on the other side. Well, here we are back again, and one of the things that we see periodically, particularly in dogs and occasionally in cats, that shake their head violently because of allergies or chronic ear infections, general itching that they just get whacking at their head pretty hard with their rear paws, is a thing called an ear hematoma. An ear flap is kind of like a cartilage sandwich. There's two two pieces of cartilage with skin on the outside of each. And what happens is one of three major veins in the ear flap will burst, and then the bleeding occurs between the two layers of cartilage, and it fills up. So we'll see these dogs will come in and they'll have an ear 2 to 3 times as large as it normally is. It's not very painful, interestingly enough. There's 3 ways to approach solving an ear hematoma problem, and one is that you can try tapping out the blood, but there's a lot of clot and fibrin and other types of tissue in there that make tapping it out difficult, and we frequently see it reoccur, and we may even inject some steroids in it, but the success rate with that solution is less than 50%. You can leave it alone, but what ends up happening is that ear scars down and it becomes what we would call a cauliflower ear in a person. Depending on the location of the hematoma in the ear, that can stricture the opening of the ear canal, which then leads to other problems. So the best solution is to surgically clean out the ear. You make an incision, you remove the blood, you remove the clots, and then you suture it down tightly so that the cartilage heals back together. And that generally works very effectively in solving an ear hematoma problem. I wanted to quickly cover a topic that you'll hear more and more, I think, over the next few months, the next few years, and that is some heartworm disease in dogs is becoming resistant to the monthly medications. And there are studies going on that are trying to answer that question, and the jury is still out as to whether that's accurate. They have discovered a new strain of heartworm larva called the MP3 larva, and that one is a little more resistant to the doses of the ivermectin or the Revolution or the Interceptor, any of those products that are currently on the market. That's a bit of an issue from that perspective. But the Interceptor-like product, the milbomycin that is in Trifexis, because that's a new product, was tested against the MP3, and what they have found is that it's not likely that one dose will provide ultimate protection, but 3 doses will provide ultimate protection. And that leads us to the statement that heartworm preventive, regardless of what product you're using, should be year-round, 12 months a year, same day every month for your dog and your cat using Revolution or HeartGuard for cats, because we need that ongoing protection, and we can't leave a window of opportunity where a microfilaria larva that's been deposited by the transmitting mosquito has a chance to kind of sneak through and cause heartworm disease in your dog. So that's the take home. Once a month, every month, 12 months out of the year, no exceptions. That is now considered the standard of the profession. I got another question from Andrea. She indicated that my older cat is acting strange, eating like crazy and losing weight. Why? Well, there's certainly a number of reasons. The things that we think about are diabetes. But frankly, when I read that, my first impression is that this kitty has hyperthyroid. And what hyperthyroid is that in dogs, low thyroid is generally the thyroid disease of choice. But in cats, hyperthyroid, there is a benign functional tumor of the thyroid gland that develops, and it produces excessive amounts of thyroid hormone. So it really ramps up the cat's metabolism. It causes strange behavior. A cat that's always been real social may suddenly decide to go look and hide in the closet all day, or they'll start walking around vocalizing, and then they act like they're continuously hungry, not just hungry, but ravenous, and yet they're losing weight. And so frequently when we see them, they will have lost 10 to 40% of their body weight, depending on how quickly they're brought into us. A simple thyroid test will tell us whether or not we're hyperthyroid in 99% of the cases. We also need to know about heart function. We need to know about kidney function because those problems often dovetail with hyperthyroidism. There are 4 ways to treat hyperthyroidism. One is a medication called methimazole given once daily. There's negatives with every way, but that's probably the most negative because the potential for side effects is pretty high. Caution should be that you should wear gloves when you're giving these pills to your cat because it does have the ability that if it gets absorbed through your skin to cause problems for you. The next way is to surgically remove that offending thyroid nodule and then have it tested, and that's a very effective way. And I've done many thyroid tumor removals very successfully. Occasionally it'll develop in the other side and you have to go back and do the second side later in its life. But at that point, you're looking at age and other factors and deciding whether you need to. Another approach is radioactive iodine therapy. Very effective way of treating. It treats everything, and so it is definitive. And its only negative is, well, there's 2. One is you have to leave your animal at a hospital that is licensed to do radioactive iodine therapy, and they're usually there 4 or 5 days. The other is expense. It's about a $1,200 expense to have that surgery done. And the newest way comes from the Hills people with their science research and a diet called YD. And YD is restricted in iodine and is safe for all the cats in the house, but it will effectively treat hyperthyroid in almost every case. There's a great way of doing it with no side effects, no large out-of-pocket expense, and it's very effective. So that's just another indication of what when you get a company that's doing true science research, what they're able to develop because of that research. I read an article recently about feeding raw foods, and we've talked about this before. There's a niche of people out there that want to follow a diet called the BARF diet. Seems like such an appropriate name. BARF stands for bones and raw food, and so in feeding these raw foods to your dog, theory being, well, that's more like what they would do if they were out hunting in nature, and there may be some truth to that, but they're eating more than the bones and the meat when they do that. But the other thing is that there are over 50 diseases that are transmitted through raw meats, both chicken, eggs, beef, pork. Those raw meats are capable of contaminating your kitchen counters, contaminating you, and contaminating your yard through the feces of a dog eating that. It is just not a good idea to feed raw foods to your pet. The last thing I want to just touch on briefly is the advent of wellness testing. I'm probably going to become a fanatic about this because of what happened to me, of course, and how through just a little glitch in the giddy up on my electrocardiogram led to my discovering of 2 serious problems that could have been very detrimental to my long-term survival, and that is the one with my heart needing a triple bypass, and the other was an obstruction of my left carotid artery. And my physician had listened to my carotid arteries and felt my carotid arteries every time I've been in for at least the last 10 years. And he was not able, through listening, to pick up on the fact that I had a 95% obstruction of my left internal carotid artery. Vascular specialist I saw today actually mentioned that when men over 60 should have a annual screening of their carotid arteries. It's inexpensive, a lot less expensive, I promise you, than what I paid to have my carotid artery cleared out and my life saved as a result, but likewise could be life-saving. How do we relate that to our animals? Well, I think that as our animals age, those annual exams, annual lab work, breed-specific recommendations of ultrasounding the abdomen of flat-coated retrievers or golden retrievers because they have such a high incidence of abdominal masses, checking pressures in eyes of dogs at risk like Cocker Spaniels or Basset Hounds as a part of a routine wellness exam, far more important than getting every booster exam that every booster vaccine that they need. So that's it for now, and we'll be back in a minute. Back to wrap it up, and I really want to encourage you to call the office, 419-885-4421. Make a reservation for Dr. Tate's seminar on Wednesday, April 24th at 7:30. Dr. Tate was a former member of a federal FEMA team called a VMAT team, and she's also one of the founders of the state DART team, which is a disaster animal relief team. She's going to be presenting some PowerPoint on how the government deals with these major events like Hurricane Katrina and Hurricane Charlie. Changes that have been made that they discovered since the events, because in the early stages of those events, people were not going to shelters because the shelters wouldn't let animals in. And so she's got a lot of really interesting information. So feel free to attend. Everybody's going to get a door prize, and there's going to be a drawing for a gift card as well. I want to thank Elanco, makers of Trifexis, your once a month heartworm, internal parasite, and flea control. Hills, the makers of Science Diet and RX Diet. Advanced research has led to both the YD and the new diet control product called Metabolic Diet. We have seen great results in the early stages of using Metabolic Diet with no other changes in an animal's life cycle. Esplin Medical, the maker of bamboo cotton scrubs, naturally antibacterial, environmentally friendly, just extraordinarily comfortable to wear. EsplinMedical.com. And then Sylvania Vet. Want to encourage you to check us out in two places. Check us out on 13abc.com and get connected. I think you'll enjoy the video that's on there. And then also check us out on a regular basis in the Toledo City paper. We have an ad in there, and every time we have an ad in there, we highlight an area animal that's from one of the rescues that's up for adoption. And so it's another way to get exposed to animals that need a good forever home. We're really happy to support area rescues, and it's just part of our community involvement. What makes us the best? We think it's all the factors that we've talked about, but 24/7 care is unmatched in the area. So with that said, there's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.